different issue. But any kind of piercing can happen. Previously people used to have scarification. It's still prevalent in the villages because people think that scarring the body sometimes protects against some diseases. So scarification also can lead to this kind of transmission if there are infected needles. Then circumcision, tattooing. Tattooing again is becoming a very popular a habit now among many young people. But so all of these can also lead to infections. If a barber uses a razor without proper care and uses the same razor in 2 or 3 people and one of the persons happens to be infected, then again it can lead to an infection. So there are multiple areas where we ought to be able to educate people to adopt better healthy practices and pay much greater attention to this. Therefore, the most important thing is we need a combination of strong policy initiatives, we need strong public education, we need our health services to be better organized and better protected in terms of hospital waste disposal, better handling of hospital waste and blood products within hospitals, safety precautions within hospitals like health workers using gloves when handling blood products. So all simple, separate steps but taken together, they can have a tremendous impact. And as the Public Health Foundation of India, while we are training a large number of people in public health, we will certainly pay attention to this important area. We in Public Health Foundation are now looking at training many people in the government services, district and block level medical officers through a public health management program which is supplementing the National Rural Health Mission. And obviously how to prevent viral hepatitis, how to deal with an outbreak of hepatitis, all of these become very important part of their training as well. But talking of the National Rural Health Mission, there is a village health, sanitation and nutrition day which is supposed to be held every month in a village so that the village community can together learn how to promote their health, how to protect their health, how to have proper nutrition, how to manage the sanitation. Some states are doing well, some villages are doing it well, several others are not. There is a great opportunity to bring about a substantial amount of health education and behavior change in the Village Health and Sanitation Day. So I would urge Dr. Sareen and his colleagues to work with the NRHM mission to try and integrate some of these messages effectively into the Village Health and Sanitation Day and into the NRHM program, because ultimately the NRHM is going to be the final platform for uniting many health programs. So the more you can actually influence the NRHM in dissemination of these messages, the more effective will be the public education and behavior change. Finally, Dr. Menabde did refer to essential drugs and the Universal Health Coverage Program, and the Honorable Minister for Health in Delhi also assured that the essential drugs related to viral hepatitis would become available free of cost. One of the major components of the Universal Health Coverage Report that we submitted to the Planning Commission last year, which is still being debated now with the Government of India and the Planning Commission, is that the Universal Health Coverage must provide to every citizen a free health care, which includes an essential package of health services, primary, secondary, as well as some elements of tertiary care, and drugs must be provided, all the drugs in the essential drug list, and vaccines must be provided free of cost. And the Government of India has already announced that from October this year there will be a new program in which all drugs in the essential drug list will be provided free of cost in all public facilities across the country, with 75% spending from the central government and 25% from each of the states. So we have a great opportunity now even to provide some timely treatment and some timely preventive measures, including immunization, through a reinforced and strengthened and better resourced health system through the Universal Health Coverage Program, which may begin small but will grow soon into a countrywide program. So I believe what Dr. Sareen has started as a major campaign in Vasant Kunj can actually become a national campaign and provide very many learnings for how best we can actually disseminate this information and unite many sections of society into concerted action. I believe the people who are present in the stage as well as in the audience represent a vital force which can collectively bring this major public health problem to a speedy halt and ensure that as Dr. Sareen said, a 5-year-old child does not have to die in vain because neither public health nor clinical medicine paid attention when it was required. Dr. Sareen, you spoke of the yellow ribbon. I did not find a yellow ribbon, but I thought I'll come with a yellow shirt to say that you have our full solidarity, and the Public Health Foundation of India will stand behind you and beside you as you launch and advance this campaign. Thank you.